Hello, I'm Dr. Brianna Vesley, and welcome to Joint Ventures. In this OSC original podcast, we take a look at recent medical news and headlines and bring you the facts you need to make the best decisions about your healthcare. For all of our sports fans out there, you must know that feet are in all of the news right now. On Sunday night at Game 7 NBA Finals, the nation was watching the Thunder-Pacers game and saw Tyrese Halliburton collapse on the court. Now, what was the cause of this? He actually ruptured his Achilles tendon. And he's not the only one in the NBA to be rupturing his Achilles tendon. In the NBA, just in the 2024 to 2025 season, Jason Tatum, Damian Lillard also have had Achilles ruptures during the playoffs. There's actually been 8 ruptures in the NBA this season. There's a stat that I saw that from 1990 to 2023, there was 45 total players with a rupture, and now we have 8 just this season. So let's break it down to square one. The Achilles tendon is the strongest tendon in our body. It is comprised of 2 muscles, the gastrocnemius muscle and then the soleus muscle. These 2 muscles make up your calf muscle, and when they come together, they form your Achilles tendon and attach to your heel bone, also known as your calcaneus. There's an area called the watershed area that's 3 to 6 centimeters from the insertion of the Achilles on the calcaneus or your heel bone. This is an area of decreased vascularity. Just like when we're thinking about nature, a watershed area is when one body and another body mix and get fed from different sources. So more proximally, your Achilles tendon gets vascularity from the calf muscle, and more distally, it's getting more vascularity from the heel bone. Our Achilles tendon is very important. It's important because this is how we perform plantar flexion of our foot, where our foot points downward. It also helps us push off of our foot, jump, and run. Now, a lot of patients listening who have Achilles tendonitis or Achilles tendinosis might have been told that they have small tears in their Achilles tendon. So a rupture is when the tendon actually rips into 2 pieces, like pulling a rubber band and it pops. Now, in Achilles tendinosis, this can be accompanied by lots of longitudinal little tears. How I like to explain it to my patients is if you have a bag of spaghetti noodles and you twist the noodles, you know how just a few of those noodles actually break, but overall it's still one unit? That's what Achilles tendinosis looks like, while the rupture is when it actually goes into 2 separate pieces. Now, part of the buzz around the internet is that Tyrese had a calf strain prior to his rupture. So as we talked about, your Achilles tendon is where your calf muscle turns into the tendon that attaches to your heel. Having a calf strain means his calf was already stressed and weakened. However, also having any strain of your muscle can alter your gait and cause it to be abnormal. This can cause muscles to fire abnormal and result in ruptures. So what actually causes an Achilles tendon rupture? An Achilles rupture is associated as a weekend warrior sport typically. Someone who doesn't normally do intense sports then picks up a game of football or basketball one weekend and then ruptures the Achilles tendon. Obviously, in professional athletes, this is not really the case. Other risk factors include being on certain antibiotics, like as fluoroquinolones, which can predispose you to having a rupture, as well as having steroid use. Overuse and high-impact activities such as jumping repetitively also can cause a rupture. Basketball is known to be aggressive towards your Achilles, just given the nature of the sport. Professional athletes also have more pressure to perform at a high level and even with an injury still perform their sport. As many saw, there are so many online videos of when the rupture actually happens. Rupture typically happens when there is a sudden eccentric contraction of the Achilles tendon. So in Game 7, we see Halliburton steps off his right leg and has his ankle dorsiflex, meaning his foot is pulled up towards his shin. This adds tension to the Achilles tendon. So then when he goes to push forward, this adds contraction of the muscle to explode off of. When he goes to move forward, we actually see when he goes to push off and the recoil of that Achilles rupture. So a lot of people are asking, how do we prevent an Achilles rupture? For our weekend warriors, we need to make sure we stretch our Achilles tendon and strengthen our Achilles tendon before participating in high-impact activities. We don't want to go from couch potato to pro athlete just over one weekend. Now, for our athletes, we want to be mindful of our positioning and training and gives ourselves enough rest after our injuries. Stretching out our hamstrings and our calves is essential. One super easy stretch is simply dropping our heels off of a stair to stretch our entire calf complex. Also making sure we're always wearing the appropriate shoe gear for our activity. Now, there are some hypotheses on why there's so many Achilles ruptures right now. I read an article by Karen Silbernagel that the lower leg strengthening is lagging behind our upper leg strengthening in sports. The fact that 3 out of the 8 ruptures were on the same team, the Pacers, I'm sure they're really going to be looking at their training program and make sure they're not prioritizing a certain group of muscles over our lower leg strengthening. Another hypothesis is the amount of star players are playing. ESPN published this year star players are playing 39 to 40 minutes per playoff game instead of 25 to 30 in a regular season game. Another key factor is that athletes are doing a higher level early on than, say, 10 years ago. Now, studies have shown increased age and BMI can increase the risk of a rupture. So the longer someone's been playing a sport, this is more likely to have a long-term injury. And for bigger, more muscular athletes, this is more load on the Achilles tendon. Lastly, a lot of our athletes don't get a rest in the off-season. For example, Tatum, he went to the NBA finals, then the Olympics, then preseason, then the NBA season, and then the playoffs. So what do we do for an Achilles rupture? For our athletes, the answer is to fix it. There are many different techniques, but basically you're putting 2 ends of the rupture back together. The way I like to do mine is I perform a small incisions to minimize the wound healing risk, and I use sutures to create a locking mechanism between the 2 ends of the Achilles tendon. Now, for our less active or not good surgical candidates, we use the Willits protocol. And this is where we have a short period of immobilization followed by a gradual increase of walking and strengthening during physical therapy. Wow, well, we sure covered a lot. I hope the athletes that are injured recover quick and get to go back to playing the sport that they all love. Thank you so much for listening, and I hope that you learned something today about feet and Achilles ruptures. Please subscribe and share this podcast. If you're in the area, feel free to come visit me and talk about your different options for foot and ankle pathology, get x-rays, and talk about anything you'd like to related to feet and ankles.
At Orthopedic and Spine Center, we're dedicated to providing the highest quality treatment using the most advanced technology available. Our fellowship-trained spine and interventional pain management physicians specialize in diagnosing painful conditions and offer minimally invasive interventions to complex spine surgeries. Our pain psychologist helps patients understand and reduce stress from chronic pain conditions. Our experienced physicians get you back to doing what you love. Call today for an appointment. Experience excellence at Orthopedic and Spine Center.